One.
Alright. Hey Ryan, I just talked to Brad. He said that he's been hearing voices from people. He said that I asked him that if the voices tells him to like hurt himself or hurt others, but he said no. He said that they just like tease him, and like sometimes it just makes him mad or sad, but otherwise he's not hurting himself. There's no signs of injury. Um, there's no signs of orders as well. He said he just feels tired. Um, he's quiet. He's just he cooperates as well. When I initially entered the room, he's just like hugging his knees, rocking back and forth, but and also like muttering incomprehensibly. But otherwise, there's no injury I found. Um, yeah. I took a vital signs. I was able to get a vital signs, vitally stable. Like heart rate is like 96, and rest rate 20, and blood pressure is 122 over 76. His pupils a little bit dilated. It's like 5 millimeter, but it's pearl. Yeah. The room is kind of messy as well. Like the bed is just unmade, and there's like dirty dishes. It's like, and the smell is just not good. I don't. Is there like probably a signs of neglection right there? We can just probably call CAS for this. I don't know. What do you think? What'd you get from the mother?
Yeah, so the mom was telling me pretty similar stuff from the way he was kind of presenting. She says this has been going on for a couple of years now. When he was younger, he had some problems with like neglect, and he's been bullied for a while. They said when he was around 10, there was like a domestic problem between like the mother and like her old husband, and they separated. He had to go to a new school, and then when he went to the new school, he started doing bad with his grades, and like he couldn't really make any friends. And they said like a year or two later, so like 11, 12 ish, he went to a therapist and got diagnosed or got given a medication of risperidone just to kind of help him out through that. And they said that did initially kind of help with his mood, and he wasn't having these symptoms anymore. Um, and then ever since then, it's been getting a little bit worse. They say typically when he had some of these events, he's kind of just like sitting down on the ground, rocking back and forth, muttering to himself. And then sometimes he'll tell his mom that he hears voices. Typically, the voices are like people from his school. And she says that typically like, they tend to tease him, and they try to make him feel like anxious, and he ends up getting aggressive. And sometimes he tends to lash out because of that. He's like hit the mom before, and she kind of suspects that he acts similarly in school. So besides that, leading up to this, he's been fine. Like when he came home yesterday, he was his normal self. As you were saying, he's like a pretty quiet guy, a little more introverted and kind of keeps to himself. And then randomly he had a break, and he started having this event. And yeah, she says that something must have happened at school, and that the police have had to go to school before for issues like that. So she thinks that must have been what caused him to freak out. Um, Besides that, though, he's a pretty healthy kid. You're saying vitally stable. He has no real medical concerns besides the schizophrenia. Um, and no allergies. And he's on two meds, the risperidone that I was talking about, and then he's on olanzapine as well. And he's up to date on both of them. He follows his scripts as given. That's basically all I gathered.
Okay. Yeah, so like when I entered the room, he's just like hugging his knees, rocking back and forth. He
Yeah.
rarely like he rarely like he was not tracking me when I entered the room. When try to speak to him, it probably distract him and like look at me, and he just went back to like not look at me after that. But how do you think we would manage this patient? Probably gonna transport this to LHO.
Yeah, I would say we can bring him to LHO. Like the mom tends to have like a pretty like good grasp of what's going on in his medical history, and like this is a pretty like normal event for him.
Yeah.
She says all these like antisocial behaviors and withdrawing from other people who he isn't familiar with is pretty typical when he's going through some of these events. And that since the medications don't seem to be like minimizing these symptoms anymore, that this is
Okay.
kind of like his baseline when he's not on medications. But like she showed me the bottles and everything. They're all followed as they should be.
Okay, that's good. Um, I guess is it you said it's just a baseline right now, right? Is there a reason why the mother called for him? Is it, yeah.
It's just because like the medications typically do work.
Mm-hmm. Oh, okay.
And then since the fact that he's having this breakdown right now and he's not doing everything as he should and he's not his symptoms aren't controlled and he's rocking back and forth like that's
Mm-hmm.
not the way he's acting when not in a crisis and she wants to be over the crises at the end of the day.
Right. All right. Okay, just let the mother knows that we're transporting Brad to the LHL and hopefully he can talk to a psychiatrist there. Um, so yeah, other than that, there's no obvious injuries, there's no evidence of overdose. It's just the room is kind of messy right now. I don't think if the mother's been visiting him or something like that.
Um,
Um,
what do you think on that? From my point of view, like the mom seems to care for the child, and
okay.
like he does have a history of like abuse, but she was saying it comes from the father. Like, do you have any signs besides like the unmade bed that you were seeing?
There's no really signs of like trauma or anything like that. There's no laceration or like scars from previous, you know, attempt to like hurt himself. But I guess maybe we can just mention it to receiving hospital, but we don't have to like call CES for this, I guess. Say
Okay.
that because like you said, like the mother seems concerned about him.
Would you say it's like unreasonably messy? Like, with this, if you walked into this without this history, would you call?
The room is kind of dark. It's like all the blinds are closed and like yeah, just like dirty dishes on the tables. Um, and the smells, like a there's like a smell of like a rooming house. Uh,
Okay.
but other than that, I think it's pretty good. Did you ask the mom like when's the last time she checked Brad?
She said that yesterday, like, all she's saying to me is that yesterday he was his normal happy self and nothing was really
Okay.
going on. And then after school and after whatever happened there, that he was starting to have another episode. But she didn't
Okay.
really say when the last time she checked on him or if he ate or anything like that. She kind of just gave just that blanket information.
Okay. Well, let's just transport him to the hospital, I guess.
Okay.
Yeah.
What do you want to go on?
There's no attempt of suicidal or anything like that. There's no immediate like danger to the patient. So let's just go code 3. Um, yeah, we could just CETAS 3.
Okay. I'm
Code
comfortable
3.
with that.
All right.
Okay. I'll go start driving.
All right.
All right.
Go.
Nice. Nice. Okay, where is the end record? Um,